Namaste. Hello, friends. Today we have Dr. Ameet Kishore with us. Dr. Ameet Kishore, with over 25 years of experience as ENT surgeon at Indraprastha Apollo Hospitals, New Delhi. First of all, we congratulate to you, sir, for giving a gift of joy of hearing to over 1,500 lives through cochlear implant. Sir, today is World Hearing Day. We would like to, we will be glad if you share some light on the specific day.
Namaskar ji, thank you very much. Yes, World Hearing Day is an initiative of the WHO and is celebrated this time every year. There are a number of reasons for this very important day. And the first is that we all need to recognize that amongst us in our society, be it children or adults, hearing loss is a very common problem. But because it is often a hidden problem, a hidden disability, we don't often recognize it. So we want to increase awareness that hearing loss is common and that it needs to be recognized. The second important fact is that if the hearing loss is not treated in time, then it can cause a lot of disability in our day-to-day functioning, in the education of children who are born hearing impaired, in the functioning of adults like you and me who cannot hear. So that's very, very important, that early identification and early intervention is the key. And the beauty is that this is one of the senses that can be treated. So that is a third message that we have, is that be treated effectively through surgery, through hearing devices, or ultimately through the technology of cochlear implant. So this is the whole ethos of World Hearing Day. And along with spreading the message, we wish to celebrate the success stories of thousands and millions of children and adults who have been treated through medicine, through surgery, through technology, and through this science. We've been able to restore their hearing and allow these children and adults to come back and integrate back into normal society like you and me, be functioning, useful members of society like all of us. So we wish to spread the message and celebrate the success stories of intervention through technology on World Hearing Day.
So we have witnessed the success of cochlear implant through these last years among the kids and many other adults. So we would really like to understand, what is this cochlear implant?
Right. So cochlear implant is one end of the spectrum. It is the most advanced form of technology that allows us as hearing and ENT specialists to restore hearing in children or adults. Now, this is a technology that is used in those individuals who suffer from a severe to profound hearing loss, which is a very significant hearing loss, which cannot be corrected through other means like surgery or aids. And the difference is that the cochlear implant is a electronic device, a very sophisticated electronic device, which is implanted surgically into the inner ear of the individual. They wear a processor on the outside, and this technology, what it does is it picks up the sound, it converts the sound into an electrical impulse, and this electrical impulse stimulates or gives a signal directly to the nerve of hearing, because that is how you and I hear. So in those individuals where the hearing inner ear, where the hearing nerve cells are not functioning, this technology replaces the malfunctioning hearing cells, and thereby through cochlear implantation we are able to provide normal to near normal hearing in those individuals who have a very significant degree of hearing loss.
So how is this cochlear implant different from the other hearing aids?
Yes. Now, hearing aids, to put it simply, are a very sophisticated amplifier. What the hearing aid does is it picks up the sound, it filters the sound, filters the speech out of the background noise, and it amplifies the sound. It makes it louder. So it is very useful technology in those individuals who have some amount of residual hearing. You have to have a mild or a medium degree of hearing loss, and if that is referred to, it's because it amplifies the sound becomes louder and maybe a little clearer, and thereby people with a moderate degree of hearing loss can hear normally through a hearing aid. Now, in people with a significant hearing loss, the hearing aids don't work, and they don't work because for a hearing aid to function, you need to have residual nerve cells, hearing nerve cells. There has to be a certain population of the cells in our inner ear. So in people who have a severe degree of hearing loss, they also have a significantly damaged proportion of hearing cells. So that is why the amplifier function of the hearing aid will not work. In that situation, we move to the different technology that we've discussed, and by directly stimulating through the electronic chip, which is inserted into the inner ear, by stimulating the hearing nerve, we can bypass the poor hair cell function and allow people with a severe to profound hearing loss hear normally. So the technology is different. One is an amplifier, and the other is an electronic processing device, which sends an electrical signal directly to the hearing nerve.
So, this cochlear implant can be used for adults, pediatric, and even for the elderly.
Absolutely. So we have all ages of individuals who can suffer from a significant hearing loss. So we have children who are born with a significant hearing loss, and these would be one category of individuals who can benefit and immensely benefit from hearing loss, from cochlear implants. The other category is people like me, for example, and if I have developed, no, I had normal hearing, I've developed speech, and then for some reason, due to illness or medication or age, I lose my hearing, then I would be an excellent candidate. In fact, I would be a very good candidate for a cochlear implant because my brain has already learned language and I just need to get sound back into the brain. So adults will also be extremely good beneficiaries of cochlear implants, and certainly elderly people who have good nerve function, good neural function, if their brain function is fine, they will be very good candidates as well. So if we look at, I look at my own series here at Indraprastha Apollo Hospital. In the last 10, 12 years, we have done over 1,500 candidates who have received cochlear implants, and we have children right from the age of 8 months up to adults who are more than 75 years of age. So yes, if we select the individuals correctly, then all types of age-related hearing loss can be treated through cochlear implant.
So, how long do cochlear implants last? Like, do we have a specific shelf life period?
Okay. So, well, they are designed, cochlear implant at the end of the day is an electronic device. It is an electronic um, um, piece of technology. And although they go through stringent testing and validation processes, they are designed to last for life. Reliable cochlear implants do have a very long life. We have individuals who've been using the implants for 20 years or 30 years or even longer. Being an electronic device, there is always a very, very small chance of some electronic malfunction. So that is always possible. But with the good devices, the reliability rate of cochlear implants using the standard international criteria are in the range of 99.5 or 99.7%. So they have very high reliability, and therefore it's expected that they are going to last for a few decades. Yes, they can be, if there's a malfunction, then they can be replaced. New devices can be implanted. So that is not a problem. If the external processor malfunctions, that does not require surgery. That can easily be serviced or repaired because that is an external device. There are two parts to the cochlear implant: the surgically implanted part, which will last hopefully for the lifetime, but at least a few decades, and the external processor, which can easily be serviced whenever the need arises.
So, do cochlear implants work the same for everyone at every age, or are there some variants?
Um, the age and the way it works, the technology is the same. The technology is to pick up sound, convert it to electrical impulse, and send it to the inner ear and therefore to the brain. So the technology is the same. The way it is utilized is different. For example, children who are born hearing impaired need to be able to hear to develop speech and language. Yes, so if you and I don't hear in early childhood, we will not develop speech and language. We cannot go to school and we cannot educate ourselves. And function in a normal hearing speaking society. So for the little children and the babies who are born hearing impaired, the hearing that we provide will allow their brain to function, learn language, and therefore they can become hearing and speaking children. For the adults, it is the same technology, except that the brain has already learned language, so therefore the adaptation to cochlear implant is much quicker. Yes. So if I have a hearing loss, my brain has learned I need to get the cochlear implant in, and within a matter of a few weeks to a couple of months, I get accustomed to the hearing. I just need a little bit of auditory training to get used to the sound and the device, and I can function normally and even can talk on the telephone. In children who have not be habilitated, they need to go through a process of habilitation. So once they get the cochlear implant and the hearing is restored, they have to go through a process of habilitation through our speech and language therapists, our audiologists, and that can take time, 1 year, 2 years, or 3 years, as normal children do, to be able to learn language. So the process that is involved in the treatment is a little different if we are looking at children who are hearing impaired from birth and have not developed language versus adults who've already developed language, and they will get back to normal very, very quickly.
And so, can they swim, shower, sleep, and listen to music, and do the all the regular, normal, daily activities with the cochlear implant?
Oh, absolutely. So the cochlear implant technology, the whole idea is that we want recipients to lead a normal life. Yes. So the external processor has to be protected against water. So the only thing is that if the child wants to swim or take a bath with a cochlear implant, he can do. There are special waterproof pouches and kits that are available into which you will place the processor before putting it on the ear, and that keeps the processor protected from water, like you would do for any other electronic device. That you don't want the water to get into it. Otherwise, you could remove the processor and then you could have a swim and take a shower. But if you want to hear while you're swimming, that's perfectly possible using the aqua kits, the waterproof kits. You can sleep with it. Of course, it might be a little uncomfortable, so people choose to take the processor off when they go to sleep. The internal implant is sealed under the skin, so there is nothing. Once you take the processor off, there's nothing on the outside, so that's completely sealed. As far as sports are concerned, yes, lots of our children and adults have to engage in sports, so they can perform normal sport activities. You have to be a little careful when it comes to contact sports, in case somebody hits on that side. But otherwise, we have children who are playing tennis, who are playing football, who are swimming, who are carrying on all normal activities, running, cycling. So yes, we can lead an almost normal life with cochlear implants with a bit of care.
So, how long is the surgery goes, and what is the recovery for the cochlear implant surgery?
Okay. Very, very apt. You see, like anything that we do, it requires a comprehensive team approach. At the end of the day, my priority is safety. It is efficiency, and at the end of the day, we want not safe result who's trusting his family member child's life in our hands. So we take that very, very seriously here at the hospital. So with the team that we have, there's a team of technicians and doctors and audiologists, nursing staff, with the operating theatre equipment that we have. So with a comprehensive team approach, I am proud and glad to say that here at the hospital, we are able to carry out cochlear implant surgery very safely and swiftly. So in our hands, in less than an hour's time, we can complete cochlear implant surgery on one side in a child or an adult. And if we were doing bilateral, if I was operating on both the ears at the same time, which is again the standard of care, because if I have hearing loss in both ears, I want to restore hearing in both ears, then in a matter of 2 or 2.5 hours, we can complete bilateral cochlear implant surgery. These children or adults are in hospital only for a day and a half. So they come into hospital today, they get the surgery today, and they can be discharged by the day after. So about 36 to 48 hours stay in hospital, short surgery thanks to the comprehensive team approach. That is very, very important for us. And then within a couple of weeks, they are back to normal. So our audiology team will switch on the device in 10 to 15 days of the surgery, and these children then will attend the habilitation program. The adults will attend the auditory verbal training program or go back to normal activity. So it is an ear operation. It's not a brain operation. It is a very delicate operation. But again, as I repeatedly say, we are able to do that thanks to the comprehensive effort, and that is why we can operate on our youngest child, who's 8 months old, had bilateral cochlear implants, was out of the hospital in 2 days with very happy parents, and it all comes down to teamwork and expertise and good quality care.
So there's one question from a viewer who wants to ask whether one cochlear implant or both in the single sitting is suggested or not.
Okay, like I just said, God has given us 2 ears. We hear from 2 ears. So first of all, when a family or a person or a child comes to us, the whole team, which is myself, we have a team approach. So they're not only seeing me, they would see me, they would see my audiologist, they would see our habilitationist, speech and language pathologist. They would have extensive testing, very detailed hearing testing, imaging through CT MRIs, speech and language assessment. And once all the tests are done, we have a cochlear implant clinic where the team sits together and discusses the best treatment for that child or adult. It could be a hearing aid, it could be surgery. Now, once we come to that decision, we then have to decide whether that individual requires, from a hearing point of view, just one cochlear implant or two, or is it two hearing aids or one hearing aid or one cochlear implant? It depends on the degree and the level and the type of hearing loss. So that's the first decision. If we decide that that individual is going to benefit from two cochlear implants because both the hearing of both the ears is very, very significantly impaired, then we would recommend bilateral, which is simultaneously having both ears implanted at the same time. There are lots of advantages. You have only one surgical intervention, so one trip to the hospital. It's an anxious moment for everybody. We understand that and sensitive to that. So in one time, we can have both the ears implanted. The audiologist can activate both the implants at the same time. The brain gets signal from both the ears like what happens in normal individuals, and therefore the brain development and language acquisition in children is much quicker. So the standard of care, the gold standard, if we can afford it, is to have, and if we need it, is to have both cochlear implants implanted at the same time. And we can do that because our surgical process is so swift and safe that we can do that in the amount of time somebody else might take much longer to do one. Now, of course, there are many situations where families are not very sure, or we are not very sure, and in that case, we would then advise that one can go for one cochlear implant and then do a sequential cochlear implant later if the need arises. Or if the structure is such that we advise accordingly. So there are various options, but if it is the requirement for the individual, then and if it is medically feasible and viable, then we would certainly recommend that both ears have to be treated. The hearing should be restored in both ears at the same time.
So through this discussion, can we conclude that early intervention always benefits?
Oh, absolutely. Early intervention is mandatory. You see, our brains have a limited time of learning. So let us look at two scenarios again. We have children who are born hearing impaired. Now, you and I learn language in the first 1, 2, or 3 years of life. That is the maximum, the peak time. It's called neural plasticity. The nerves can adapt. They will modify the connections depending on the stimulus that we're getting. So it's very, very important that we stimulate the brain in those early years. So we have to intervene early if we want a child with hearing impairment to develop normal or near normal language. It is very well evidenced now in the literature. We have lots and lots and lots of data to show us that children who get early treatment, early good habilitation, good therapy, will do much better and be closer to their normal hearing peers as children who have a delayed intervention. And even a delay of 6 months to 1 year can make a difference. In adults, there is a concept of auditory deprivation. So if I'm not hearing very well, then slowly and steadily my brain begins to forget and lose that function. So again, while I have speech and language, but we see adults who have been hearing impaired for a long time, and what happens is that the quality of speech deteriorates over a period of time because the brain has forgotten to listen to sound, and those areas don't get used. If I don't use my arm for a very long time, if it's in a plaster cast, for example, and then when I remove the plaster, I don't have the same strength. I've got to go through a lot of exercise to get that strength back. So similarly, auditory deprivation does have an effect. So early treatment, early intervention is very, very important to be able to get the best benefit from whatever treatment. And for early intervention, it means early diagnosis.
Sir, thank you so much. Thank you for sharing such a detailed information and such a beneficial information on the cochlear implant on this day. So we would be very thankful if you leave a message for our viewers today who have their in the family or in the friend circle or in the loved ones, anyone suffering from the hearing loss. A message from your end to take away home.
Yeah, thank you very much for this opportunity. With the long experience, I've got 25 years of experience with cochlear implants. It was a long time in the UK till I came back to Indraprastha Apollo Hospital, and we have a very, very large, one of the largest and most successful series of hearing implant success stories. Now, and that is because of a few things. My message to you is that be aware that hearing disability, hearing impairment is very, very common in our society. Just because we look normal, the children look normal, does not mean that he or she may not have a hearing impairment. So please be aware that hearing impairment is one of the most common disabilities in our society. That's the first thing. The second thing is that it can very easily be detected. So if any of you, any members you have in your friends, in your family, you feel might be struggling, then please ensure that they see their ENT doctor and their audiologist to get a hearing assessment. So if a child's not responding to sound, if the child's speech is not developing, speech delay is a very, very common problem for which we see children at the age of 2 and 3. And in my opinion, that is very late. So if they don't respond to sound, there's delay of speech, they're not babbling very much in the young children, then please have the hearing checked. It is a norm. Each child must have a hearing test. Now, we at Indraprastha Apollo Hospital and our other hospitals have a newborn hearing screening program. You do not leave the hospital. A newborn does not leave the hospital without having a hearing test done. So, but if you are aware of people in your family where kids are born, then please ensure that the hearing is tested. So it is very, very easy to do. So hearing impairment is common, but it's very easy to diagnose. There is newborn hearing testing. There are very easy tests that our audiologists can do in older children, in adults. So if there is any sign, we've talked about children, in adults, if you feel you're missing out on some things that are being said, you're misinterpreting words, you're straining to listen, these are signs that there may be a hearing loss. It does not do any harm. It's a non-invasive test. It doesn't take very long. Please have your hearing tested. Once you've had that done, early intervention. Ensure that you see the specialists and get the best treatment as early as possible, because that will allow you to function to the best of the ability. It will allow the technology, be it hearing aids or cochlear implants, to give you the best result. Delaying is only going to make it more difficult for you. At the end of the day, we all want to function normally in society. We want to be useful members of society. We want to interact socially, professionally, and hearing impairment can set us back significantly. The beauty is it can be diagnosed, it can be treated, and we can all get back to normal. There is no reason why any of you and I should suffer because of hearing impairment. And that's the message today for all of us on World Hearing Day.
Thank you, sir. Thank you so much. If anyone have any questions, any queries from Dr. Ameet Kishore, please reach to us at askapollo.com, and you can meet him, take the time, and at askapollo.com. Thank you so much, sir. Thank you for the day.
Thank you very much.